Shockwave therapy for the foot and ankle is an amazing treatment option. Here's what it is. It's essentially a ballistic projectile that vibrates back and forth based on magnetic wave, creating acoustic waves through a transducer. Here's what this does. As it vibrates through the tissue, it increases blood supply over 2 to 14 days. It breaks down calcification and rejuvenates the joint and tendon. So essentially, here's a before and after. Swollen, irritated tissue with minimal blood flow, stagnating and causing irritation. And now lots of cross-linking, redevelopment, increased blood flow developing. Controlled studies show new blood vessels developing over just 0 to 12 weeks. Dramatic versus the baseline. It's a 5-minute treatment. You literally have nothing to lose. There are very minimal downsides. It's part of your appointment, so don't worry about getting charged $1,000. It is safe and it helps you avoid surgery. We utilize this at our clinics with amazing results. And the benefit is you're moving almost immediately. So insurances are accepted. It's part of your regular treatment. This is not a cosmetic or elective treatment at our clinic.
This is our office's Shockwave device. So as you can see, here's the power settings. So the frequency and how firmly it impacts your painful tissue. So this is the handle right here. About this size. We use a rubber cap generally, that's for pain purposes, so it doesn't get too tender. And as you can see, there's a handle down here. So you press on that with your foot. So I'm pressing on that with my foot right now, and you can see it starting to vibrate already. So essentially, you take it against your foot and you push it like this. So you can see my hand's pulsating a little bit. And you can see it pulsating against there. Now, necessarily, this device does not hurt significantly. Most people describe it as a pain that feels fairly good. So, the way we would do it is we draw out the specific area of tenderness. If we were to ultrasound it, we'd be able to visualize that it's a painful tendon or ligament injury. We wouldn't specifically use this Shockwave device on a broken bone or an acute injury, but a chronic injury where you have swelling and inflammation. So see right here, we used it at 12 hertz and a power of 120 joules, and it did about 219 cycles there. So we can just reset that. For a painful region, we would do approximately 2,000, although it can vary if you use it across different areas. The benefit of this machine is you could use it and continue with activity. Zero downside. At the same time, most people get a little bit sore in the morning, the next day, but then they're feeling significantly better. Here, for example, we circled the tender area. This is where you have the most inflammation confirmed on ultrasound, so your plantar fascial ligament is significantly thicker. We can see on the settings, we refresh to start. So right here, we run it like so. No significant pain to the site. Most people describe it as a pain that feels pretty good. A little bit of bruising the next day in the morning. But generally, you can continue using this pain-free. So it just massages out the area. So other areas you could use it on the inside of the ankle, the posterior tibial tendon. So right through there. And also the Achilles tendon. So right through there if you do have any Achilles tendonitis. And that actually feels pretty good doing it. You'd think that this thing being as strong as it is, it would cause some pain, but not significantly tender. There, you can put it back. And you see right there, we did about 642. You'd probably do about 2,000 the first time through.
Studies are there, evidence is there. We don't do the upper body, but it's proven on the shoulder, tennis elbow. We do it for the heel, the Achilles tendon, not so much here, but these are all effective treatments. And it's proven calcification, new blood flow formation. You can see the x-ray evidence right here. Plantar fibromas in our clinics, we see these disappear all the time over just a matter of weeks. Plantar fasciitis, Achilles tendonitis, extremely effective, very tolerable. It's not painful at all with very effective results. So come on in. It's a 5-minute treatment. You have nothing to lose. It's part of your appointment. It's safe. You're moving immediately and you're avoiding surgery. So come see us at our clinics. If this helped you at all, please visit our website where you can get even more information. And if this video did help, give it a like and a share, and we'll see you soon. This is MichiganFootDoctors.com.